So why do people need to check with somebody else? When they come in, I need, check with my wife. It's because it's to get out of an awkward situation they're in, or it's a way to put the blame on someone else and not themselves. It's a way because they don't maybe trust themselves against, when we're talking about weight loss, because they've been on so many programs before and they failed and do not want to do it again. And, they might even do this secretly and not tell their spouse, here, honey, I'm going to go see another weight loss place. Oh, you've already spent $10,000 before, so she comes in here secretly to kind of see what we're about.
So hi guys, welcome to today's masterclass. As you guys can see in front of us, we're going to be talking about the world of I need to talk to my husband first, or I need to talk to my wife first. Just, those typical excuses that you guys might hear when you're working on your day 2 or trying to essentially sell a treatment plan to your patient, right? So Dr. Singleton here has dealt with all objections from A to Z. He's going to be walking us through today about the few objections that he's personally dealt with, how he's been able to kind of navigate those objections, and even we'll go into the extent of what he does like during that appointment to kind of help that selling process to become a little bit easier. So Dr. Singleton, when you're ready, you have the floor.
All right. Thanks, Ann. One of the things that I always will say first is try to handle the objections before they even come up. Because if you have all these objections from what you've done in your practice, no matter what you practice, then you're going to know by the next one, what to say. Because if it's going to come up like this, I need to talk to my husband first. And I'm going to go through and how do we handle that? And it's going to be something you've never heard before, but it works amazing. So there's my list of things that I've done over the years, all the offices I've trained, still coach and train, speaking here and there and everywhere and across the world. All right, let's go in. So who's this for? Any doctor that sees patients that try to get them to do their program, no matter what it is, whether it's NUCA, maybe you have an off. One of my doctors has a colonic machine in his office. I mean, it's a crappy deal, right? Doing a colonics, but it's something that he enjoys, and he helps patients cleanse and detoxify. So doctors that need some extra tips to close more patients. I know today's a little bit different since 2020, but if you present it and have the value and they see the value, you're going to get a higher percentage rate of close. So the PowerPoint today will cover some of what I do, like weight loss, decompression, neuropathy, but you can extend that even more. So why do people need to check with somebody else? When they come in, whether you're buying a car, I need, check with my wife, it's because it's to get out of an awkward situation they're in, or it's like, well, I don't know. It's a way to put the blame on someone else and not themselves. It's a way because they don't maybe trust themselves against, when we're talking about weight loss, because they've been on so many programs before and they failed and do not want to do it again. And, they might even do this secretly and not tell their spouse, here, honey, I'm going to go see another weight loss place. Oh, you've already spent $10,000 before, so she comes in here secretly. This happens a lot, to kind of see what we're about, right? So first they come in for weight loss. Now I have a symptom assessment. A symptom assessment I developed years ago to help me figure out the cause, the why, because I used to do a lot of blood tests, blood scans. And, somebody comes in and can't lose weight. So we do all these blood tests and they all come back normal. And you're kind of going, okay, what have I got now? So I came up with this symptom assessment, and the survey lets me know what, if they're in fat burning, fat storing. So it's a 3-page printout to review that with the patient. So I have 2 today I'm going to be going over after this program. And also at the end of the symptom assessment, I put in there, well, the programmer did, how much they spend, because we ask them these questions. So you're going to know how much they're spending every day, every week, and every month. So they're going to come up with it like $400 to $800 every month. You're going to see how I use that in a minute here. Then we do a Tanita scale on the right-hand side there. It shows us everything from like metabolic age, like a lot of people who are 60 years old, metabolically they're 90. It shows us their BMI, their body fat, body water, how hydrated or dehydrated they are, and visceral fat. Visceral fat is important because if they have visceral fat above a certain where it's above normal, they're going to have a fatty liver, and that fatty liver is always the precursor to diabetes. And then it tells you the body fat of each arm, each leg, the torso, muscle mass. And so we use this to chart the patient's progress every week. So it's another objective way to, and they love seeing, hey, let's see how I am now. Let's see how I am now. So that's what we use. But also when they first come in, we give them a value tour. They get a Tanita, but we also give them a value tour so they actually get to see the area. Because if they just come in and go right into your office, they don't get to see everything. And if you can show them all the cool things you do, whether it's decompression, whether it's, your rollerbed tables or, whatever therapies that you do, your gym, your exercise room, all that stuff, so they can see, wow, they're really thorough, if you do all that stuff. So it's good to give them a value tour. It doesn't take long. Now, show them how you are different. Remember, we're still talking about weight loss. How are you different? Let them see why the programs that they've been on have failed and why they did fail. One of my greatest phrases that I always use, because they'll tell me, well, I've done this. I've done the keto. I've done the intermittent. I've done blah, 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 blah. I said, well, would you agree with me that what you've done has not worked? You don't need to argue with them. Oh, I already take supplements. I already take that. Well, would you agree with me that what you've done doesn't work? And then they need to see that you believe what you do will work. Like if you're talking about just about chiropractic, how many chiropractors get adjusted regularly? I get adjusted once a week, and now I'm not even doing chiropractic anymore. I still get adjusted once a week. And so those are some of the things that, we talk about, you got to drink the Kool-Aid. We got to have a better analogy because, as you know, everybody who drank the Kool-Aid in Texas died. But drinking the Kool-Aid is a phrase meaning that you don't do as I say, not as I do. No, do as I do and what I say, because I have experience with that. And then you let them see testimonials of patients that did the program. So we have a link right there, the drsingleton.clubreduce.com. We have a bunch of success stories. And I sit right here with my monitor, and we go over testimonials. So the patients can see other people have been there. So if there's a female sitting here, I'll show them female testimonials. If there's a guy sitting here, I'll show them guy testimonials. So we're handling objections before they come up. Well, how do I know this program works for? How do I know? Well, because other people are going to educate you and let you know that it did work for them too, and it can work for you. And I put this in here. It's kind of dumb, but show them you did it too. I was 350 pounds and now I'm on my high school football weight, and so, you just got to do that stuff, and I remember one of my clinics up in Wyoming, they were having a hard time selling. And so I drove up there. It took like 4 hours to drive up there to check them out. And I talked to the person coaching, the person selling programs. Well, she not only had her coffee mug behind the monitor, she also had a Diet Coke sitting there. She said, well, those are for me. I coach patients to tell them not to do that, but it's okay if I do it because I'm the coach. And all this stuff. I hearing all this BS. I'm going, oh my gosh, she doesn't buy. Have you done a program yourself? Well, no, I haven't done the program myself, but I read the manual. I got the training. I know what I'm saying to the patient, but yet you've never done a program. So there's no passion there. It's a job for her. And it's a job. Patients can read that. Okay. In fact, I had a doctor, several doctors who worked for me over the years. And some patients would come and say, in fact, one of them was my cousin, all he cares about is money. All he cares about is money. So, because he got bonused on what he was able to sell, and we paid him a base, and he was just, but money can't be that issue. I remember days where I'd come out and they go, Dr. Singleton, today you've already sold $25,000 in programs. What are you doing? I go, I'm just loving the patient into care. And there's other things you can do is like listen to some audiobooks like the Science of Getting Rich by Wallace Wattles. And another one, James Allen did As a Man Thinketh. So if you think that way, you're going to attract that. Be honest but nice. Woman says, I need to check with my husband first before I spend that much money. And I say, well, let's pretend your husband is here now. So I look into the empty chair next to her. Or can we call him on the phone? Let him, oh, no, don't. He's busy because, he doesn't know she's there. Well, then let's pretend that your husband is right here. What's his name? Bob. Okay. Hey, Bob, thank you for coming in to support your wife. I know you're here because you support her and you want the best for her. here's some paperwork that she filled out. Let me just show you that she's spending about $400 a month to keep her weight on. And by the way, she doesn't even work, right? I understand she just is a home mom. And she not only spends 400 a month, but because her BMI is like 37, she also spends an additional $400 a month. So if you go to George Washington School of Public Health, you saw that on my last PowerPoint presentation. George Washington School of Public Health shows that women above 30 BMI spend about $4,800 a year. And there's all the research on how they come up with that money. So that's an additional $400 a month. So your wife is spending $800 a month to have no libido, to keep her weight on. What would you be willing to do to support her? How much could you, check her? If she does this program, this will help her feel better, have more energy. She's going to fit better in her swimming suits and her summer outfits. By this summer, more libido. Yeah. You know what he's going to say? Bob's going, hey, you know what? I'm going to get a second job. I love my wife and I want her to look like that again, because that's what she looked like, 30 years ago or 20 years ago, whatever, before kids. And you basically handle that because you tell her, Marjorie. So when you go home and you talk to your husband, is he going to look at you and go, I don't really give a crap about what you feel like and what you look like? No, he's going to say, I will support you. If he doesn't support you, he's an idiot. But, you already know that, most women marry idiots. But other than that, they do care a little bit. How you handle that, it sounds too good to be true, but yeah, he will support you. Now, if that still doesn't work, which usually does, I have an ace up my sleeve. So I said, okay, then go home and talk to your husband and then come back on Thursday and we're going to schedule you for a sauna and a body wrap, just like this. That's one of my employees. We're going to schedule you for a sauna body wrap to feel what it feels like to be thin again. And this is going to be on me. I'm going to do, remember, there's still a warm lead. Warm leads are a lot easier than trying to get a new cold lead, because I really want you to feel this. Now, Thursday comes, they're in the body wrap, they have a blanket on, and I go in there. Hey, Marjorie, what did your husband say when you talked to him? 9 out of 10 say, I didn't talk to him yet. I'm like, are you kidding me? I'm like, So anyway, so are you ready to get started? She goes, yes, I really like this. I like the feel. I like how I feel. And so you just have to kind of give them some things, because if you give people certain things, they're going to feel like they owe you something. But the thing is, I'm trying to do here is let them feel what it feels like, because it's going to release endorphins. Like if you go to another service like tanning beds, they'll give you 1 or 2 free visits. And when you're in there, you're going to release endorphins. You're going to feel good to be there, and you're going to want to buy more programs. Yeah. A gym, you go to a gym and say, yeah, you can come 2 times and just try our stuff out. See if you like it. They're going to sign up, because there's a lot of gyms out there. Some are really, really busy. Some are, they call them meat factories. It's just, so if you find one and you like it, they let you come in a couple of times, you're gonna join. So this is what they do. You just kind of pattern yourself after what works, what other businesses are doing. Okay. Number 2, spinal decompression. Explain the why. This is really, really important, because too many doctors have spinal decompression tables, and when the patient comes in, they're getting results while they're coming in, but when they stop coming in, it comes back, and then they go to another doctor because this didn't work for them, because they haven't found the relief with other providers yet, even doing it. Now, start with the microbiome of DJD. In fact, Google. So what I do is I Google microbiome and DJD, degenerative joint disease, and it'll show that you got to get the gut health. So I draw a map of the stomach, the gut, the microbiome, how we're absorbing, 30 to 50% of what we eat. And the reason being is, your microbiome on a scale from 1, to 10 should be a 10. In fact, I'm going to show you in just a minute here, the study that I give them, I go over with them. If you don't restore this, it's going to cost you a whole lot more money down the road, because they never address the cause. Other places never address the cause. So you're putting them on decompression. If you don't include nutrition, you're doing a disservice. Not now, but then you're missing out on recurring revenue down the road. So what I do is I prepare the area with the laser. So I have a thermal imaging camera, and I take a picture because it has lasers in there. So I'll know I have 3 different spots, the spinous process, transverse process on the side. So I can literally take a picture and find out where and the temperature. and where the hot spot is. They've done this years ago. In Palmer College, way back, 80 years ago, they had this thing called a go scope, that you went down the spine. It would show you where the temperature reading was hotter on one side or another. Give them an adjustment, go back, temperature's normal. But now we have some, modern cool cameras that will really do that. See the difference. So then we use a powerful class 4 laser, and then we do on the decompression. Now you need to know the decompression table, the different levels, how to set them up, pro, supine. I've developed a program for the thoracic spine, like the T1 through T5. How do you do that? I figured out a way to help with that, to lower the table all the way, put them in severe flexion, okay? And it really helps to open up that channel. But we also, again, use the nutritional side, because that'll decrease swelling, inflammation, and the healing. And then we also do ozone injections or some homeopathy injections. Check with your state, see if you can actually do that around the SPs, around the vertebra, cervical, lumbar, okay? Then I also, when they're done, I also use some K-tape. I did this, started using this in 1996 in both of my clinics. Hired some guy from Japan actually to come over to show me how to do this. And now it's a big thing in the NBA, the Olympics, everywhere. It's amazing stuff. And you can leave it on because it's waterproof. So here's a review, just a quick review of, I say, here's some 6 consequences of untreated back pain that will cost you more money down the road. Because they're looking at this, well, I can't afford this. Well, you're going to be paying a whole lot more money down the road if you don't do something about this. So we go through a little bit about chronic back pain that can lead to anxiety, depression, reduced quality of life, drug dependency. I mean, that's crazy. People not only get on the Oxycontin, oxycodone, but fentanyl and all these other things they're on. Spinal injury. If you wait too long, they're going to want to give you surgery. They want to, because you can't get relief from the drugs. And then it leads to spinal stenosis, which is narrowing of the canal or the exiting nerve roots because of the DJD, and all going back to the microbiome. That's going to affect your sleep. So it's going to be a domino effect that's going to basically kill your life, quality of life. Depression, loss of mobility. You're not going to be able to get around, do things with your family, with your kids. And if you lose mobility, I mean, think about it. If someone took away your driver's license so you could never drive again, what's that going to be like? That's not going to be fun. You'll be depressed. You won't love life anymore. So how about mobility just in your own house? You can't do things. You have a hard time going to the bathroom, just doing things you used to love to do. Muscle fatigue. Your body's not going to recover, and it's just going to get weaker and weaker, and your life's going to suck pretty much. But don't give up. We talk about what we can do to help you. So I'm going to give you a couple of visits. Give you a couple of visits because I want you to see the results. I want them to feel it. So this particular person, let's see here. Is it here? It's actually, frequently asked questions. But here is where I talk about a lady who comes in, and one recent patient just recorded results after 2 weeks. But the second week of June, she said she was planning for surgery, but wanted to try decompression. I was doing some advertising with Proactive, and she came in, and she was glad she came in. And I actually have the video of what she said while she was lying on the bed, because every night she'd cry herself to sleep. She was in so much pain. She couldn't even leave her house. She lived up in the mountains, this beautiful area. She couldn't even go on hikes. She couldn't even really do anything. And so if you want to see her video, text me that number and I'll send you, that's my office number, but text me and I'll make a copy and send her the recording for what she said. So again, my practice is to treat pain, the middle paragraph there, treat pain, arthritis, where it came from. And I've taught thousands of doctors, speaking at conferences, how to do this, how to reverse the inflammation in the body. So again, no matter what you do, all roads lead to the gut. And if you don't believe me, Google it. It's right there. Here are some studies also in the 6 consequences. So what they've done now is go down to the red. Basically, they found, so I have a disc here showing them. I have a little vertebra here, but I have another one that's not in here, but I have a little vertebra, and I have the disc that I have the different levels of degeneration. And I show them that there's a microbiome in the gut. Let's say it's 1 to 10. You want it to be a 10. They found a microbiome in the discs. So whether you're doing chiropractic, decompression therapy, whatever with the spine, you got to get the microbiome up in the disc. And how do you do that? You get it up in the gut. So here's a study they found. They found a microbiome in discs, just like the ones that exist in your gut. Protective bacteria were more abundant in normal discs, and bad bacteria were more abundant in degenerative and herniated discs. Wow. So the patient comes in, I give them nutrients to help decrease swelling inflammation. So when they come in for their next visit, they go, wow, those nutrients are really helping. No, well, it's that plus the other things that we were doing. So they're shown what works. When you go travel somewhere and they have rental cars, Hertz, all the other companies, Dollar rental car, all these it's the companies like Ford, Chevy, they donate these cars. It's marketing. They donate these cars to Hertz. So when somebody goes in and drives a Jaguar or whatever, there's a percentage there. The people, like I've done it twice. Years ago, there was a Ford Expedition and a Toyota 4Runner years ago. And I drove those. I rented that. And I'm thinking, oh my gosh, I love this. So what do? I go home and buy one. So it's marketing. When people experience something that feels good, that rings true to them, that it makes their senses love this, they're going to want to do something. They're going to spend money. Then they're going to want to peel away those dollars. Okay. And that's how you handle objections, again, before they even become an objection. Ring to the core, what people love. Show them how much better they're going to feel. So again, on the second visit, we rescan and see where we're going to go forward. We review the cost according to how long it lasts. So I say, how long did it last? Whether it lasted a day, did it last for 2 days, or just 6 hours? Then I have 6 levels of treatment options. That lets me know which program to put them on. And then if you have back pain, here's another. If you have back pain, you're going to miss days of work, and they're going to know that. So try to get a promotion at work. We want to have Bob be the lead, but he's been missing work like once or twice a month because he has back pain. Well, you just missed out on a promotion, and it's going to cost you even more money. You're not going to make as much money because you're letting your back. They call back pain sitting. The new sitting is like the new smoking. So in fact, I have a table here that goes up and down. I push a button, it kind of goes up so I can stand up half the time and sit down half the time. So they need to know that. Now see how serious they are. Remember, they're warm leads. So get them 1 or 2 treatments to show them that you really care. And if it decreases the temperature as you scan their back again, it's working. You show them it's working. So I take the picture and I print it out so they actually have the before and after pictures on paper that they have in their hand. So, and again, with the samples, they see the difference. They see how great it feels. And guess what? Even if they don't buy, they're still warm leads. So then I follow up with them in 2 weeks, and then in a month, and then 2 months. And guess what? They still have the pain. And so I talked to them about using their flex spending, their HSA accounts, or their tax returns they can use for that. So we have different financing to help them to get started, or we have pay per visit too. They can come and do pay per visit. Remember, objection is like always money. Review monthly payments that they can make, and then show them other financial areas to get them qualified. So we like Care Credit, some other financial institutions that we use to help get them qualified, because some people can put on a credit card, put $5,000 on a credit card. Some people are going to have to make monthly payments. I mean, you don't want to have your office be a monthly payment place, where somebody comes in and puts $500 down and they pay $150 a month. You don't want to be a financing institution. You want to farm that out and not worry about that and just focus on your patients. Number 3, neuropathy. This is a great program because people have no hope on medication. Gabapentin, Lyrica, Neurontin. What do I call it? Neurontin. It sounds like rotten medication, right? We run neuropathy ads with Proactive to get the message out there in the valley where we're at. Now, make sure you're handling all aspects from A to Z so you'll have raving fans that keep buying products to keep neuropathy from coming back for recurring revenue. In my area, there's a few doctors here, some nurse practitioners, and they're charging like $10,000, $25,000 for neuropathy. And I'm going, serious? They're not even addressing the cause of neuropathy. If you want to go back and look at a PowerPoint that we did with Proactive Angie, there's a neuropathy. I kind of go through all of that, the cause, and how to actually address the neuropathy the right way. Because I get these people coming in, like one lady came in 2 weeks ago. She spent $5,000 for one treatment, some injections of stem cells and some IV And she's like, that didn't do anything. So they're covering up the symptoms. They're not going after the cause. They're charging patients all this money. And patients want to do something. Neuropathy is great. So neuropathy is going to get worse. So you want to educate them on the cause again. Go back to the PowerPoint. You'll see the cause of neuropathy. You'll be surprised on the cause. Then take a thermal imaging picture of their foot, like on the left here. You see where it's blue down by the toes. It'll actually give me a temperature, and those toes are in the 70s. Then let them know I have 6 different levels according to the coldness, and I will show them what happens with if you don't do something. You're going to end up like with your foot being amputated like this. Now, the cost to do nothing. So handle objections again. The long-term costs associated with amputations are between 100 and 500,000 because amputees are going to require multiple prescriptions of prosthetics. Ongoing access to high-quality prosthetics is crucial for somebody who has suffered amputation. It's not fun. Now, here's my how do I handle objections on this? Again, I handle objections before they're even an objection. So I show them testimonials so they can see, hey, this does work. My 4 options. Okay, Bob, we have 4 options for you. You can do nothing. Option 1 is do nothing, but retrofit your house with a walk-in bathtub, handicap the whole house, costing, $20,000, $50,000. But, good luck trying to sell that, that house down there. That's a lot of money to retrofit because when you're going to lose your toes. Start saving for an assisted living place that's going to cost $4,000 to $6,000. Insurance may pay up to 90% of that. So there's going to be like $400 to $600 per month that you're going to have to come up with. I mean, my mom had amazing insurance and she had Parkinson's and I was paying $500 a month, and she had my dad's retirement and her retirement school. And she was in a really nice facility, but I still had everything. We had the family members had to kind of pitch in. And if you're willing to pitch in, if your kids are willing to pitch in, you tell them this, maybe how many children you have? I have 4. Well, if each one of them paid $200 a month, then you'd be able to be in a nice facility. Well, I can't have my kids do that. So, because they don't like that. They want to take care of themselves. And then 3, someone's going to need to take time off work to take you to all of your appointments for the fittings and maintenance of your amputation of your foot or leg. And I let them sit there and think about that. So those are some options. But I told you I have a 4th option. This is the best one too. We were able to get your temperature up, like it was 75, we got up to 80 after 1 treatment. So that shows me that we can reverse your neuropathy for around $5,000. It's about $220 a month for 18 months interest-free. I actually pay your interest. So $220 a month just for 18 months. And then you have your life back. You can do things. You can go golfing again. Like you said, you can't golf anymore. You have a hard time walking the dog around the block. You can go down 2 houses, then you have to try and come back because your feet hurt so bad. Wouldn't you like to walk the dog around the block, the whole way? So these are the things when they look at, they go, yes, I want that. I want that. And they felt the difference from day 1, from the visit 1 or 2 that you're able to give them. So again, you handle patients by letting them see what you can do. Now it's all about caring because they want to know, because they're going to know if you care or not. Know your information on how to reverse what you're treating, which 99% of the doctors do not know. So the doctors, that came in that I coached, they don't understand what causes these things. They just do what they learned in school and try to do that. But you can do so much more. See, when you see how to reverse what you're trying to treat, you'll be excited. It will show, and you'll be able to handle objections in your office. So, you get a brick wall, you go around it, you go under it, you go above it. And to give them the information that they need. So they're like, you know what, this makes sense. This makes sense. And it feels good here. It feels good because you've talked about things that other doctors haven't talked about. And you give me a visit or 2. And that really did see the difference. I really love that. I mean, we have a program with Proactive where they're coming in for contour, where I have a machine, an ultrasound machine. I take pictures of before and after, and we measure them. They're losing 2 to 6 inches on the first treatment, and they can see it. And then they want to buy more. It's a no-brainer, right? One last thing. People want to know how much you care before they care how much you know. And you'll be able to handle anything. Also, just love your patients because you have love at home. I know it sounds kind of cheesy, but if you have a broken home, your office is going to be broken. Every person that goes to a divorce, their office goes like this. Their office goes down in numbers because their life is broken. So if you want to help your patients, help yourself, feel better, do nutritional programs, exercise, do things that you need to do so you're at the top of your game. And patients will know that. If you walk in there and you're not smiling, you're not happy, because where does happiness come from? Serotonin is produced in your gut. Your gut's happy, you're going to be happy. Patient's going to feel that. In fact, there's one thing. Dr. Bruce Lipton found that this is kind of not out there, but your microbiome actually gives off energy. And if you're giving off good, positive energy from your body, from your chemistry, patients are going to feel that. They're going to want that. Patients going to want more of that, because you have friends that are like negative. You don't want to be around them. You have patients that are positive. They're all saying, hey, Angie, how are you doing, man? You're looking good. I haven't seen, my gosh, tell me about you. Tell me about your life. Tell me about how the trip went. And you're like, oh, I love this person. This person's talking about me. That's what people want. They want you to care about them. And people can feel that. So thanks for watching today. Now, if you have any questions with or any help with objections you're seeing, you can text me. That's my office number for the doctor's cell, my doctor's number. Now, if you need any help doing some marketing like I do with Proactive, text me. We can talk about that, and I can show you what I do with them. Again, I'm doing the following, like weight loss, neuropathy, decompression, and pain management. I don't know what chiropractors do more than that. Most of them are doing pain management. So, and then there's my website if you want to see what I do, my little for the clinic here.
Awesome. Thank you, Dr. Singleton. Very thorough presentation, right? And I feel like you dove into literally A to Z from the point of delivering that treatment. You touched on your weight loss assessment that you do, to all the way to at the point where you guys are negotiating and talking about deciding on a treatment plan. And then he even went to the extent of how he goes through his actual appointment with that specific patient to make sure that selling part of things goes a little bit smoother. Kind of gives you ammo, right? This is basically just trying to help you guys build up that ammo, so that way when you get to that day 2 process of like, hey, this is what you have to do to get better, and then they're giving you excuses or whatever, then this is how you would handle it. So if you guys have any specific questions, you can text Dr. Singleton himself, or you can also comment down below. I actually have a few questions for us here in front of me, Dr. Singleton. So somebody asked here, how do you deal with a lead when you're offering a care plan, but then they tell you that the price is too high for them? So the obstacle is finances. What do you usually do with that?
Well, if that's a package program, you're trying to sell for $2,000 to $3,000 or $4,000. I can see that. So what you do is you do visit to visit. Again, you need to impress them. You need to impress them, press upon them how much better they're going to feel. So, well, then I'll tell you what, why don't you just pay for 2 visits or 3 visits right now? Come in 3 times a week next week. Yeah, I like this. This is going to feel great.
Yeah, and then I think we even did like previous master classes, guys, about how to offer, financial help to some patients, because most of the time, a lot of insurance doesn't cover services like this. So there are options out there for you guys to get some support, or to help your patients get support to pay for things like that. I think even like the extent, Dr. Singleton, correct me if I'm wrong, but even the extent of like making the payment a little bit more digestible for them, that also works, right?
Yeah.
Yep, exactly.
Start, give them some relief, and they're going to be like, okay, because they'll figure out a way to borrow the money, get the money. I've even talked to them about, I asked them, do you go to a church? Do you belong to a church? Oh yeah. Talk to the person in charge, because a lot of them have charity. So you say, hey, I'm suffering with this. It's affecting my job, but I don't have the money. Do they have donations here? And I've had checks written to me from other religious institutions to cover this patient's payment.
Yeah. It's definitely like a priority thing. Like if there's always demand, if you create demand for it and they find the urgency to get the help, and you guys are following Dr. Singleton's process in terms of, creating that urgency for them, then they're going to go out and find that. They're going to get the help that they need. I also have another question here. Somebody from the team internally actually asks you, how do you deal with a person that says, I need to think about it? So they gave you the excuse. They're not giving you the excuse about like, oh, I need to go talk to my partner. Oh, I don't have the money for it. Those aren't the excuses. The excuse here that we're dealing with is, oh, I need to think about it, or even like, oh, I don't make decisions on the same day. How do you usually combat that?
Let's pencil you in. Let's schedule you for one treatment. As you're thinking about it, in the process of thinking about it, let's give you a treatment so that you're going to see what we're going to do. So that'll give you more information on how you're going to feel. So give you one, just get you one treatment, and that'll kind of get you to be able to make a decision, yes or no, if you want to continue with this or not.
Uh-huh.
And I say it like that, yes or no, not kind of pushing him into something. Oh, he said no, because I can decide if I don't want to do it. But who wouldn't want to do it? If your program is so great, if your technique is so great and you're doing everything that you're supposed to, they're gonna want to stay with you. Remember, patients buy the doctor. So when they say I need to think about it, they didn't buy you yet. You didn't sell yourself enough with passion and love for them. So again, doctors need to sell themselves. Like we do at home, you sell yourself to your wife, your kids, or your husband or whatever. And it's a love relationship. And if you have that in you and the patient can feel you care, it'll help them make a better decision.
100%. I agree. And then like he said, like Dr. Singleton said, right before the end of this masterclass, right? Like really the catalyst to, a patient making that decision is them feeling that care, them feeling that trust, that love that you see in front of us right now. They want to feel that care. And if they don't feel that care or feel that, you can create that change that they're looking for, then there's, and in the most simplest terms, they simply don't trust you, then it's going to be a really difficult process to get them to, make that decision and move forward with treatment.
Just last week, I had a patient come in for weight loss, and she has her hormones were really imbalanced. So I was telling her about a patient that came in, and she said, yeah, my husband doesn't deserve me. She had vaginal dryness. Her libido was down, and she couldn't lose weight. And it was not fun for both of them. So this helped me. And so I said, yes. So I put her on one of the programs, which is a Candida program. Her hormones got balanced. So 2 months later, she comes and gives me a hug. And she said, my husband loves you. My husband says, do whatever Dr. Singleton says, because he's saved our marriage. And so a lot of times I'll tell patients these stories, and I love doing so. I'll get emotional. I'll start crying. And obviously, if I start crying and, in front of a patient, I'm talking about a patient, wow, he really cares. He really cares about his patients. Yeah, I really care about the patients. And they're going to see that. They're going to feel that. Remember, it's a feel thing, and
yeah, a lot of the selling stuff is emotional driven.
Yeah.
So, Dr. Singleton, do you have any other last statements that you want to touch on before we wrap up our meeting here?
If you can't figure this out, go back to your day job. No, you know what? Yeah, you can do this, and there's training, there's things that you can do to learn, because they don't teach us in school. And if you don't get it, if you don't understand, like I had a doctor who from New Jersey, he said, I can't close. I said, well, send me 2 to 3 recordings of what you're closing, your report of findings. If any doctor out there wants to do that, I'll listen to it and I'll give you advice what's going on. So he sent me 3 recordings, and as I was listening to him, I'm like, this doctor has diarrhea of the mouth. He didn't let the patients talk. He was telling how cool he went to the Tony Robbins mastermind programs, and he was certified and all this stuff. But I guess he didn't get it because the patient couldn't talk, and he didn't ask the patients and tried to find out what was motivating the patient to do the program with him.
Yep.
And guess what? He didn't get it. I talked to him. He didn't get it. I said, then you need to hire somebody who gets it, because you need to stop meeting with patients because you suck at closing patients. So he hired somebody else who's did a lot better job than he did. So
that's awesome. Yeah. That's golden. I know that if you want to get some feedback on your day 2 process and Dr. Singleton is willing to offer a hand, that's golden. So yeah, guys, we have the resources here to help you guys out with anything that you need, from the point of how to be a better business owner, how to train your staff, how to close that treatment plan better, how to sell more treatment plans. We have you guys covered from A to Z. Our team, our entire team here, and Dr. Singleton and our other power partners are here within this group to give you guys support. So if you guys have any questions, feel free to post that into the group, comment down below. We always have a masterclass every single week, so please attend the lives and feel free to ask any questions, even if it's outside of the subject that we're talking about. We are here to help. We emphasize this every single week, and we want to support you guys. So Dr. Singleton, thank you so much for the amazing presentation. You're always doing great. Always doing great.
Thanks.
We will see everyone next week. Okay.